Health Awareness Month, but there is still a lot of stigma surrounding mental illness.
And for many people, well, mental illness, it's a sign of weakness. And if you can't just snap out of it, then it's perceived that there's something wrong with you. To help us with all of that, we invited developmental coach and also CEO of castcenters, Mike Baer. So good to have you here with us.
Yeah, and thanks for being here, Mike.
A lot to dive into. First, let's talk about how dangerous this stigma is.
Oh yeah, you know, depression is very dangerous because depression is one of those things that's progressive. You know, the saying time heals all wounds. It does not with depression. Time does not heal it, and it gets worse and worse, and eventually it leads to just decimating a person's life.
And the hardest first step, according to a lot of folks, is finding that therapist. How do they go about that?
Well, I would say finding the right treatment because, and it's difficult to find the right therapist. You know, today since COVID, all these therapists want to work from home. And I was talking to you backstage about it, Lou. You know, it's when you've been in isolation, the best thing is to get out of that and to connect. And so I would highly encourage someone to seek treatment or a therapist that sees them in person if they're struggling with depression.
Okay. Let's talk a little bit about the warning signs out there, the red flags, and there can be so many of them. We're going to run down the list, but first up, how do you know if someone requires outpatient treatment?
Sure. So someone requires outpatient treatment when they are very stuck and can't seem to get enough out of just seeing a therapist. So at castcenters, you know, we've been around for over 17 years, and what we see is a lot of people who have been going on for a few months just can't get out of it. They just feel so stuck, and they just are hopeless.
And sort of lack of interest in activities too, right?
Oh yeah, definitely a lack of interest in hobbies, and typically they're just unmotivated, flat, pretending to be okay.
Yeah. Big weight gain or loss of appetite, that comes along with it.
Yeah, and big weight gain is often an excuse. Someone will say, I'm just been really stressed and I can't make it to the gym. But when someone's depressed, they try to eat their feelings or they just stop eating because they're just not hungry anymore.
And this is a big one, isolation, and also someone who wants to avoid all social activities out there.
Oh yeah, we all know people like this, right? They used to be so social and friendly, and we've all been, I used to struggle with clinical depression, and that's how I got into this field. And you know, it's one of those things where you feel like you're not loved. Yeah. When you are isolated, you really feel unlovable. And so the best thing to do is get out of that comfort zone of just isolating.
I have a couple of girlfriends who are struggling with that, and it's hard to, like, I don't know what to say, right? Because you don't want to be like, oh, it'll be better tomorrow, you know, but so that's kind of interesting. Well, when they're isolating.
Yeah, there's two things that motivate people. One is pain, emotional pain, physical pain, spiritual pain, or consequences to their life not changing. So the best thing you can do is say, I love you so much, I see you struggling, let me help you find some treatment options for you.
Yeah. And you talk about treatment options. One of the biggest hurdles for those looking for treatment, it's cost. So how do you navigate that?
You know, one of the great things today, which it did not used to be like this, is insurance covers a lot of mental health treatment. So even outpatient treatment at castcenters, you know, we're able to take so many insurance policies. And previously, insurance did not cover. So one is insurance, and the other is there's a lot of community resources in Los Angeles. There's a lot of funds and grants so that you don't have to suffer. There's always a way. Yeah. That's what I've found.
So frequent feelings of loneliness, sadness, and hopelessness. You know, a lot of us are stressed. You know, we have a lot going on. You have 2 kids. You know, I've got my big dog that I'm taking care of. We've got our careers. How can we tell the difference between, like, I'm just having kind of a, like, this is not feeling good for a week, as opposed to what you're saying is clinical depression? Right.
One sign is chronic crying. Oh, okay. You know, crying even when there's moments that are kind of happy, or crying in moments that it's just not appropriate. But you're right, life's stressful and it's really difficult to tell. I mean, someone can call us at castcenters and get a free assessment to see the level of what their needs are. But that's a good question. I think if it goes on for more than a few weeks, it's a problem.
Okay.
And even a day like today, you know, we call it May Gray. It can really shift a person's struggle with this. When there's no sun. We live in Southern California. We love the sunshine, but anything can trigger that.
Yeah, and I think also it's just feeling alone. You know, so the best thing to do is really to get out of the gray is get into life and just connect with others. You know, it seems so simple, but it really works.
But sometimes depression is it's a disease, right? That sometimes it needs to be medicated.
Right.
That's okay.
Yeah, some people need to get on psychiatric medications, and some people need to get out of a really abusive situation.
Yes.
And some people need to go back and look at the trauma from the childhood, like
the
I
work.
did.
Yeah.
And
Yes.
look at why I was in this hopeless state based upon the family I grew up in. So everyone's different. Getting recovery is a loose garment. Everyone has their fit. And so the goal is just like, let's figure out your fit.
And it's
So, yeah.
so good to see celebrities coming out in front, speaking about this, and removing the stigma, really.
Yeah. Thank you guys so much for having me.
And love that you did the work as well.
It
right?
works if you
Appreciate
work it.
Yeah, it works if you work it. Exactly. Thank you so
Thank
much
you.
for being here. All right. And also, if you want advice here, you can get in touch with Mike Baer. He also mentioned the rest of his team at castcenters.com. They're located in West Hollywood.
What a fantastic segment.
Yes.
News we could all use, We all struggle with the challenges of life. Kai
Yes.
Goldberg.